who is completely reliant on Medicaid for the health care and services that allow him to live in and thrive in the community. We are here today to thank the California State Senate and Senate President Pro Tem Limon for standing with people with disabilities and presenting a bold proposal that would hold corporations accountable and reduce the impact of federal Medicaid cuts. Last year, the majority in Congress and President Trump passed H.R. 1, which cuts $1 trillion from Medicaid over the next 10 years. That same bill gave about the same $1 trillion of tax cuts to giant corporations and the uber rich. They are cutting taxes for the rich on the backs of disabled people. Is that fair? Is that fair?
No.
While we cannot blame the California legislature or governor for these massive cuts to healthcare, it is now up to them to protect disabled Californians and others in our community. Our state senators have shown the courage to backfill some of the cuts that we are expecting from the federal government. The Senate's Fair Share plan will make the top 1% to 2% of corporations in our state pay their fair share. These are huge corporations who don't provide health care to their workers and instead have them go on Medi-Cal and food stamps using our taxpayer dollars. While their CEOs become richer and benefit from the Trump tax cuts, their frontline workers are left without, and taxpayers are footing the bill. Is that fair? But today we are calling on the Assembly and Governor Newsom to follow the Senate's lead and support this critical proposal to ensure that disabled people retain access to health care and services. We are not going to stand by while big corporations give their employees Medi-Cal applications instead of providing health care. We are not going to stand by while people with disabilities are harmed by these cuts and are called waste, fraud, and abuse by RFK. Let me be clear, people with disabilities are not waste, fraud, or abuse. No. We contribute to our communities every single day, but we rely on Medicaid to live in those communities. If California doesn't act to protect that care, it will be complicit in forcing people out of their homes and into institutions. So now I would like to introduce to you Ana Alonso. Ana is representing the Association of Regional Center Agencies. She is a person with disabilities with 3 children and a mom who also have disabilities, and they all rely on Medi-Cal, IHSS, and regional center services. Ana.
Good morning. Good morning. Thank you for having me here. I hope you can see me through my story. My name is Ana Alonso from Bakersfield, California. I am the director of Padres Unidos de Kern, and I'm here today representing my family and the people I serve, the millions of Californians, and especially the Association of Regional Center. In my home, there are 5 of us, my mother and my 3 sons, 2 of who I adopt. Every single of us have a disability. Most of us, we have multiple disabilities. We rely on medical, in-home support services, and regional center services to survive every day. So, when politicians talk about medical cuts, I need them to understand there are no budget numbers. There are human life at risk. Everything in my household depends on medical. My mother and 2 of my sons rely on in-home support services. We have 12 caregivers rotating through our homes every week, providing around-the-clock care. They help us eat, bathe, move, stay safe, and especially surviving in emergencies. Without them, our family collapse. And if Medicaid cuts move forward, that's exactly what happened. We go collapse. If income support services cut, we lose the support and keep us alive, and we don't go be stable. If medical cut is cut becomes more expensive, the consequences are even more devastating. One of my son's medication costs $5,300 a month, and he takes 23 medications in total. That is not possible. I can't afford that and keep him alive by my own. So, if I want to take state senate for advancing the fair share proposal and faith to reduce the harm of these cuts. But I also need to ask Governor Newsom and the State Assembly what more they're willing to do to protect families like mine, because they are life or death decisions. Disabled Californians are not disposable. Our life matter. Our care matters. Our survival matter. Protect our health. Protect income support services. Protect regional centers, because they can't do the work alone. We need general resources. Do not abandon millions of Californians who depend on these services to live with health, dignity, safety. Thank you so much.
Thank you.
IHSS workers.
I would now like to introduce Elizabeth Gomez. She's the Executive Director of the Integrated Community Collaborative. She is representing Latino families with children with disabilities. She is also the parent of 2 children with disabilities who use Medicaid-funded services.
Good afternoon. The first thing I want to say is thank you, Judy. Thank you for all the work that you do. Thank you. Thank you. Today, I am here as the proud Latina mother representing my 2 sons with disabilities, but I'm also here representing the millions of Latinos with disabilities across California who depend on Medicaid for healthcare, for services, and for survival. Some of them are here today, and I want to let you know that most of them drove many hours to be here. Some came on the bus and stayed up all night, and some of them found the way to get here. So I want to say, aquí estamos y estamos presentes. Hardworking families who are struggling to keep the fight and the struggles that they live through every single day. Families living with fear, uncertainty, every single day. Families forced to fight through barriers after barriers just to get care for services and for their children deserve. But they still came and they are here. So I wanna say that as they came because they're tired of being ignored. They came because they are tired of being pushed aside. And they came because when they threaten our children, what do? We fight. We fight. Peleamos. Cuando tocan a nuestros hijos, ¿qué hacemos? Peleamos. For too long, Latino families in the disability community have faced inequity, access to healthcare, support, and opportunity. And the cuts coming from Congress and President Trump will make those inequities even worse. But please, listen, disabled people are not, should be led by compassion. California should lead with courage, and California must lead by protecting disabled people and the families who love them. Sí, sí se puede, sí se puede, sí se puede, sí se puede, sí se puede. Thank you.
Thank you. Thank you, Elizabeth. And now I would like to introduce Julia Feinberg. Yeah. You guys watch behind you.
Down a little bit. Could you put the mic down a little bit? Thank you. Can you all hear me?
Yes.
Can you hear me?
Yes.
My name is Julia Feinberg, and I know we just met, but I want to tell you a secret. Every day in my life that I can remember, I've been terrified. I'm terrified that one day you, and yes, I'm talking about you, won't notice or care if I'm not here. In your schools, workplaces, restaurants, or anywhere else you spend your time. Because without Medi-Cal, I literally can't survive. Medi-Cal pays for a program called In-Home Support Services, IHSS, where caregivers help me get out of bed, go to the bathroom, shower, get dressed, meal prep, run errands, and go on very, very hot dates. Oh yeah, that's what IHSS is all about. But without all of us deciding that IHSS matters, the Julias of the world will once again be segregated into an institution, away from mainstream society, away from you. While HR 1 was being debated in Congress, I couldn't sleep for months. All I had to do was look at the numbers. I knew the $1 trillion federal Medicaid funding cuts would decimate IHSS, and therefore my life. Rather than following the Senate's lead in closing corporate tax loopholes and raising taxes on billionaires to make up for the funding cuts, Governor Newsom proposes taking away healthcare and caregivers from people with disabilities, older adults, and immigrants. Shame on him.
Shame on him.
My caregivers, many who are immigrants, are the reason I have the freedom to live at home instead of in an institution. So it is only right that I repay them by protecting access to their health care. It is cruel and just unrealistic to ask them to show up for my care, but deny them their own. Our worth is inherent. That means protecting Medi-Cal for all. Because when we protect care, we protect each other. That's why I'm showing up today. That's why we're all here. To protect my ability and your ability to live in the community and to be in solidarity with the millions of people whose humanity is still treated as negotiable. If you think that no human is negotiable, then join us. I'm a member of the Long-Term Services and Supports for All Grassroots Coalition, where we fight for no cuts to Medi-Cal and a future where corporations pay their fair share. Are you with us?
Yes!
Thank you.
Thank you, Julia. So I am so honored to introduce one of the greatest champions we have in the state Senate today. This is our friend, our leader, our champion, Caroline Menjivar, who is a senator who has stood up time after time after time for people with disabilities, for poor people, for Latino families. We love you so much. I cannot tell you. And so thank you so much for coming.
Hey everyone! I was like, someone's having a party over here. I gotta come and say hi. And then I heard my name. I was like, I definitely gotta come and say hi. I was like, all of you are about to go fill inside my committee room right now, and we're gonna make some noise and we're gonna fight. Because what you said is correct. It's correct. You know who we don't see up here? Billionaires don't need to come up here and beg us not to take away their money. You know who don't need to come up here? Corporations are never doing a rally to say, please, Senate, don't do this to us. Please, Governor, don't do this. No. You know who always has to come up here? Y'all. Y'all always have to. We force you to come up here because the cuts always happen to y'all. Any single time we're like, we need to save money. How do we save money? The governor proposes. Let's save money by cutting services to you. Enough is enough. And I'm so proud that the Senate has countered the governor's proposal with our Senate budget plan that is rejecting the cuts to the backup providers, that is rejecting the cuts to realignment, the termination with Medi-Cal. It's rejecting the cuts to the hours and shifting all those costs to the county. That's not okay in my book. You need health care. You need the hours that you need to be taken care of. You need the independence. And no one, regardless of how they got here, should be put on a hierarchy and who deserves the right to get health care. So I'm so proud to stand with all of you, but we need help. We need to make noise in the assembly, y'all. I need my colleagues on the assembly to hear you loud and clear. I need my governor to hear you loud and clear that we need to find revenues for this because we are not going to cut away out of this, and it's going to be more expensive for us in the long run than what we're doing now. So thank you so much for coming out, y'all. See you in sub 3.
Thank you. All right, I would now like to introduce Melissa Cedillo. Melissa is a senior campaign organizer for Health Access California and an amazing leader of the Fight for Our Health Coalition. Melissa.
Hello and good morning, everyone. My name is Melissa Cedillo, and I'm an organizer with Health Access California, and I help to lead the Fight for Our Health Coalition. Last year, our coalition, a lot of you here included, worked diligently to try and defeat H.R. 1. California put up quite the fight, but ultimately, Congress moved forward with one of the most historic redistributions of wealth that this country has ever seen. Because of this, millions of Californians stand to lose access to healthcare while giving trillions in tax handouts to the wealthiest Americans and most profitable corporations. Unfortunately, we know that some of the communities that will be most impacted are the ones that need the care the most. While federal cuts pose new risks to our healthcare system, they've also unmasked a deeply unfair problem in the state budget. In California, taxpayers are paying an estimated $28 billion each year in Medi-Cal costs for working people whose employers have failed to provide access to affordable, high-quality healthcare coverage. Why should Californians be footing the bill for these ultra-wealthy corporations? It's time they pay their fair share, which is why the inclusion of the fair share contribution by Senate Democrats in their budget proposal is so important. It shows that Sacramento is listening and that our elected leaders agree with healthcare advocates, Medi-Cal enrollees, and people with disabilities. We cannot stand by while vulnerable Californians lose their healthcare. Millions of Californians, many of which made the trek up here today, overnight and on bus, to make their voices heard, are here to support sustainable, long-term revenue solutions to fund healthcare for all Californians. Medi-Cal is a lifeline for coverage and a foundational source of economic and health security for millions of Californians. We call on Governor Newsom and the State Assembly to do the right thing and prioritize funding for the health of Californians in their state budget. Thank you.
Thank you, Melissa. I would now like to introduce Kieran Savage Songwan, the Executive Director of one of the partner organizations that we love working with, the California Pan-Ethnic Health Network.
Great. Thanks so much, Judy. Thank you all for being here. It's really a pleasure and an honor to stand in solidarity with all of the amazing community leaders, families, and advocates who are here today. I want to thank you all for traveling up here. For us at CPEN, we've been working on advancing a right to health care for all, regardless of your race, your ethnicity, or your language for nearly 35 years, which is too long to be having this fight. Our fight to protect California from the impacts of H.R. 1 is a fight to save lives, literally. And it's a fight to protect access to care for people who have faced overwhelming hurdles to being healthy. I want to remind everyone that Medicaid is not just a health coverage program. It is the guarantee of a right to health care, which is why it was established as a civil rights era program to end the grave injustice that is injustice in health care. And now, as we see President Trump, Congress, and the Supreme Court attack our rights on every front, we must stand up. People of color and people with disabilities understand better than anyone why a right to health care is imperative. And while federal cuts would kick millions out of care and have sweeping impacts on the communities that are hardest hit by so many things that are raining down on us from the federal government, we are proud to be in a state where our Senate leaders are standing up and are standing with us to reject these cruel cuts, to reject the cuts that happened last year, to reject the cuts that are being proposed this year, and to make sure that we have a program that is there for all of us when we need it, whether it's today or many years in the future. So let's be clear about the facts. California's revenues are growing and corporations are thriving. This is not a question of whether the state can protect its most vulnerable residents. It's a question of, as the senator said, whether our leaders in the assembly and our governor will protect us and will stand up to corporate interests. With the Senate's Fair Share Contribution Plan, we can ensure that corporations pay their fair share, and we must ensure that those revenues meet the needs of Medi-Cal members, of all of us and our families. So thank you all so much for being here today. We're really proud to stand with you, and together we can win this fight. Thank you.
And now we are going to show you what it feels like right now to be a person with disabilities. We are going to show you how we feel that disabled people are on one side of this rope. So if people can pick up this rope, I know somebody's sitting on it. So we're going to show you what it's like to be on one side of this tug of war. And this is disabled people on this side. Let's hear it for disabled people. And we know that Senator Menjivar and the Senate is also on our side. But who is on the other side? I would like you to meet big corporate CEO.
Hey ho, CEO! Hey ho, CEO!
As he makes his way to the rope, we would like to talk about the pay of CEOs of the largest corporations in California. According to the AFL-CIO, California boasts some of the highest paid CEOs in the country, with the highest making over $172 million a year. Next, let's meet the representative from the McGreedy Corporation. Several years ago, the McGreedy Corporation offered their employees the McResource line to help them get on public benefits. They had to shut it down based on embarrassment and public criticism. So next time you order that Big Mac, remember that the person putting all those beef patties on the bun may have no health insurance. Moving on to our representative from Shamazon. Shamazon, why don't you come to the middle so we can get you on camera? There you go. This corporation earned a profit of $59 billion last year, profit. Yet they are listed at near the top of major corporations with significant parts of their workforce collecting public assistance. Yet, guess how much their CEO made last year? $43.5 million. Now let's meet our representative from Moorbucks Coffee. Did you know that 31% of restaurants, that only 31% of restaurants actually offer health insurance to their employees? And that 64% of Medicaid recipients actually have a full-time job. Why do these workers have to go on Medi-Cal or have no insurance at all when their CEO, when Moorbuck's CEO made almost $96 million in compensation last year? Finally, let's meet a representative from Steel Mart.
Yeah!
This giant corporation receives corporate welfare, and it tops the list year after year of employers with the highest percentage of workers on Medicaid or SNAP benefits. The workers' wages are so low that they can't afford to shop anywhere but where they work. Their CEO makes almost 1,000 times as much as their average worker. So, as we see, on one side of this tug of war, we have huge corporations that makes taxpayers pay for the health care of their low-wage workers. And on this side, Californians with disabilities, their families, and their allies. We know that the state Senate is on the right side of this tug of war. State Assembly, and Governor Newsom, where will you stand? Who will you stand with? We hope you will do the right thing. Thank you all for being here, for fighting for the right to health care. Yeah! Thank you, everybody. And now we are going to go to the legislative office building where we will fight for our rights in front of the legislature. Thank you, everyone, for being here.